Да. Само английски окей. Počituvana gospođa Patricia Di Giovanni.
Dear Miss Patricia Di Giovanni, Acting UN Resident Coordinator, dear representatives of the Diplomatic Corps, ladies and gentlemen. Good afternoon and welcome to the event marking the finalization of our event. Today we present the results of the joint program of the United Nations titled Safe and Innovative Health Services During the Covid-19 Pandemic in North Macedonia. The program was financed by the United Nations COVID-19 Response and Recovery Fund, implemented in the period between January 2021 and March 2022. The objective of this joint program was to improve the access to sexual and reproductive health, as well as the services for support of women, girls, and children victims of gender-based violence, with special focus on the most vulnerable populations in those areas where these services are not available. The program presented innovative health services such as enabling services for sexual and reproductive health through 2 mobile gynecologic clinics in remote areas, then electronic register of immunization intended for improving data collection and calculating the planned immunization coverage rate, communication of the risks with the skeptical individuals, as well as raising the awareness about gender-based violence and sexual and reproductive health for women and girls. This joint program is enabled through the contributions that the United Nations COVID-19 Response and Recovery Fund received from the governments of the following countries: Norway, the Netherlands, Switzerland, Denmark, Sweden, Republic of Korea, Finland, Austria, the United Kingdom, Spain, New Zealand, Croatia, Portugal, the United States of America, Iceland, Thailand, the Slovak Republic, Romania, Cambodia, Cyprus, and the Philippines. During today's event, we will hear the speeches of very significant guests, officials from the health sector, and high representatives of the United Nations in our country. Today with us we have the colleagues, panelists, who will discuss on relevant and significant topics in the area of healthcare. In the beginning of today's event, let's hear the speech of Ms. Patricia Di Giovanni, Acting UN Resident Coordinator in North Macedonia. The floor is yours.
Dobro utro, everyone. Respected Excellencies, friends, colleagues, partners. It is my pleasure to be here with you today to mark the completion of the joint program called Safe and Innovative Health Services in Times of COVID-19. The 2 panels will share with us the key results achieved in only 1 year, the lessons learned, but also explore opportunities to build upon these achievements, to further improve and expand accessibility of health services in remote and underserved areas, to understand and address immunisation hesitancy, and to continue strengthening digitalisation of immunisation. The project that introduced innovative health services from December 2020 through to the end of the month and is special for the UN for multiple reasons. First and foremost, because it contributed to the response and recovery from what became a pandemic-driven development emergency that affected all of us, particularly the vulnerable groups of people, and presented the world with an economic and social emergency on top of a severe health crisis. The program enabled bringing free life-saving services closer to people, particularly women and girls living in underserved areas to whom provision of such services was disrupted or postponed during COVID-19 pandemic. Second, because it was selected amongst the best of the global pool of projects competing for the UN Secretary-General COVID-19's Response and Recovery Fund, which makes us very proud. This global fund was established to enable a fast and innovative response and recovery of countries from the COVID-19 crisis through applications of the broad and relevant expertise of the UN family. The COVID-19 Response and Recovery Fund was made possible thanks to the generous contributions of 21 countries already presented by our moderator. And with representatives here today, remotely or in the room, let us thank them for their generous support. Finally, we are also proud of this project because the achievements are a result of a strong collaboration between a diverse set of partners. The government team, led by the Ministry of Health, as the main national counterpart, in close collaboration with a broad network of national counterparts, including the Minister of Labour and Social Policy, eHealth Directorate, Association of Gynecologists and Obstetricians, Macedonian Medical Association, the Macedonian Red Cross, Macedonian Association of Nurses and Midwives, the University Clinic of Psychiatry, the civil society organisations that played a major role. Also, this project results would not have been made possible without the dedicated joint work of the 3 UN agencies mentioned, UNFPA, WHO and UNICEF, who brought together the multi-aspect rich expertise of the UN family to help the country address the complex challenges that the COVID-19 pandemic brought on. If our goal is to leave no one behind, then this program definitely set models that lead towards that goal. That said, I would like to congratulate the important and innovative work done by all involved in this project in such a limited time. Under challenging circumstances, I look forward to our panellists to share the achievements and lessons learned, but also to explore opportunities and broader partnerships to sustain the already achieved and built upon results beyond this project. Stay safe, good health to you and your family. Let's all continue to take care of each other. Blagodaram.
Благодариме на госпоѓа Ди Джовани.
We would like to thank Ms. Di Giovanni for her speech. Before moving to the first panel discussion, let's see the following short video of the UNFPA as an introduction to the topic that will follow.
Имаме организирано тимови кои што се состојат од доктори од сестра.
Патуваме секој ден, се менуваме, значи сме повеќе колеги, секој ден е за различен колега. Значи ни почиња од 8 сабајле, доаѓаме до местото каде што треба да работиме, ги прегледуваме жените.
Се испраќа после тие на анализи и така, значи тоа е како да кажам, ден во мобилна амбуланта.
Значи сега се наоѓаме се уште во време на пандемија и да кажеме ограниченост, односно недостапноста на услугите од сексуално и репродуктивно здравје е всушност тоа што не натера да се мобилизираме, значи да клиниките ги направиме мобилни, да одиме на терен, да жените не доаѓаат, со тоа се намалува ризикот и од преносни инфекции, меѓутоа и се подобрува нивното здравје.
Значи станува збор за активности чија што цел е зголемен пристап на сите жени през се од рурални средини, ранливи групи, на превентивни прегледи со цел рано откривање на ракот на грлото на матката.
Сето ова не ќе беше можно без партнерството со Македонската асоциација на гинеколозија, Кушири, Македонското лекарско друштво и секако Организацијата на Црвениот крст, кои што се клучни партнери во различни чекори од овој процес.
Нашите волонтери го поставија шаторот кој е придружен дел на амбулантата, а работеа и на подигнување на свеста кај локалното население за потребата од редовни прегледи за рак на грлото на матката.
Ние имаме, за жал, се уште нерегулирана бројка, односно многу висока бројка на цервикален карцином, а исто така и на карцином на дојка и на другите генитални органи. затоа што ова превенција, овој скрининг и претходно не се обавуваше скроз, да кажеме, со опфат на сите жени.
Тие превентивни прегледи се многу битни и во сите развиени земји кои што имаат организиран скрининг за рано откривање на цервикалниот карцином, значи нивната инциденција и морталитетот овој карцином е значително намален.
Значи имаме активности, Министерството има активности за скрининг на карцином на дојка и за скрининг на карцином на грловна матка, меѓутоа голем дел од жените, негде преку 40%, не се опфатени нити со матични гинеколози, нити со овие скрининзи и за жал доаѓаат многу доцна.
Овие региони и пред COVID-19 пандемијата немале достапен гинеколог и со тоа практички начинот на кој што се оди овој проект, значи да се покрие таа популација која што не има достапен доктор, е со добар ефект.
Да успеете да откриете карцином во рана фаза и со едноставна интервенција да го истретирате е многу подобро отколку да го откриете во касна фаза, да примате многу скапи лекови или воопшто да не постои начин да вие се излечите од тој карцином.
Сега кога гледаме дека потребата е огромна, дека има интерес, работиме на изнаоѓање на дополнителни модалитети и средства како овие мобилни гинеколошки амбуланти да останат во функција и понатаму и како да го прошириме, да кажам, полето на работа, со тоа што повеќе ќе се доближиме до оние најмаргинализирани заедници со цел да се осигураме никој да не биде изоставен.
И во 2020
In 2022, COVID-19 remains a global challenge for the population and healthcare system throughout the world, and other healthcare conditions and needs of people should not be neglected because of the pandemic. In the new normality, for women and girls, they need further access to safe and quality services for prevention of cervical cancer, regular examination during pregnancy to ensure safe motherhood and best possible outcome for pregnant women and newborns, services for family planning, protection from sexually transmitted infections, referral and support for people who were victims of gender-based violence, and many others. In continuation, we are moving to the working part of this event with the discussions on the first today's panel, the moderator of which will be Professor Anna Daneva-Markovska, Chair of Committee for Safe Motherhood and Healthy Newborn. It's our honor to invite the moderator and the participants of the first panel to join us on the scene and discuss about the activities in our country in the provision of continuity in the access to services for sexual and reproductive health during COVID-19, taking account to leave no one behind. Dear guests, dear panelists, improving the health conditions is priority goal for strategic investment and development. Quality is an essential part of the concept of universal healthcare coverage, aiming to universal access to quality healthcare services, adequately effective and necessary. COVID-19 remains a global challenge for the population and healthcare systems also in 2022, unfortunately. However, other health conditions and needs should not be neglected, left without supervision because of the pandemics. We should leave no one behind. That is the central transformative motto of the Development Agenda 2030, to which the world committed and also our country. We heard in the video, and we will hear much more during today's panel with our panelists, Dr. Afrodita Šalja, Dr. Gligor Tovosky, Mrs. Sanja Sazdovska, Mrs. Lydia Šterjov, and Mrs. Biljana Žurovska. At the beginning of the pandemics, UNFPA, the Ministry of Health, were in close cooperation to identify the adequate, sustainable response. We have made structured analysis for the most adequately identifying patients' needs as regards sexual and reproductive health, with special focus on geographically remote areas and underserved areas where such services are either lacking or are not present at all. Innovative approach based on mobile gynecology clinics is fully integrated in the national healthcare system, and in this case, in this pilot project, it was focused on decrease presence of certain services and the conditions for support of gender-based violence victims. Based on previous intervention in the health system, it was identified that in certain emergency cases, the access could be made closer to the patients, in underserved areas, to women and girls. This could not be possible without the committed and coordinated work of a number of partners that jointly enabled women and girls to have better access to such healthcare services. In this occasion, I would like to thank and congratulate all parties for their dedication and support the team of the Ministry of Health, Macedonian Medical Chamber, the president of the Association of Gynecologists and Obstetrics panelists here, the director of the University Gynecology and Obstetrics Clinics, the eHealth Directorate, Ministry of Labor and Social Policy, and the Red Cross of North Macedonia, the volunteers of Red Cross who unselfishly contributed to this project. Today's panel discussion will be started with the question to Dr. Afrodita Šalja, the mission of UNFPA about sexual and reproductive health. This is a very important goal. The mission, or the basic aim, to provide a better world where every pregnancy will be monitored, every delivery will be safe. As long years a partner of the Ministry of Health, together with the Committee for Safe Motherhood, in the past 4 years, you managed to achieve a particularly good results in the perinatal health. You led this innovative model of healthcare services delivery. That's why I would like to ask you how this all started. Thank you, Professor Daneva Markova. Good afternoon to all colleagues, friends, guests. Good afternoon to our acting resident coordinator of UN, Mrs. Giovanni. I'm honestly proud that today I stand here and represent UNFPA, where together with all partners that Professor Daneva already mentioned, and many more, of course, we managed to develop a model that we will present today, and you saw a part of it on the video presented here, with great efforts of all partners, with great dedication, because to achieve such model, great efforts were needed, design, think about what is needed to keep the standards, attract clients, patients. So we developed a model that I would like to stress that includes very important characteristics, that the model, first of all, offers quality services. It is available, accessible, brings the services closer to the citizens. It is accessible, adaptable. It can be connected to other services. It is sustainable. Why sustainable, I will explain later, and integrated in the healthcare system. Yes, we are partners with the Ministry of Health. We've worked together for many years now on activities, development activities. Also, we have worked together on prevention and response in crisis conditions. Why do I mention this? I will explain later. What happened with the COVID-19, we are all aware. It imposed disruption of the access and use of services. As our fund, we need our services for reproductive health. We intensively, with our partners, thought how to provide these services because the conditions and the healthcare problems continue. However, because of the restrictions and the overload of the healthcare system and the special focus on COVID, the fear to be exposed to risk of catching COVID, because COVID itself imposed difficult economic conditions and hit especially vulnerable categories who were in our focus. There was an opportunity with the fund, multi-partner fund mentioned before, including all the countries that contribute to it. There was an opportunity to apply as UN project, and together we mobilized, together with our partner agencies, UNICEF and WHO, to apply to this fund. What we had? We had 2 mobile gynecological outpatient clinics. That's why I mentioned our activities with the Ministry of Health, with the stakeholders in the response, crisis response and preparedness. These mobile clinics were bought during the refugee crisis in 2019, and they were available. They were designed so that they can offer such services. Then we sat together with all our partners to develop the model, design the model, how to mobilize healthcare workers. We involved here the associations, the Macedonian Medical Chamber and the Association of Gynecologists and Obstetricians. And what was most important was that the field work that was enabled, absolutely enabled key points in the chain through the Red Cross. The services can be made accessible, but they may not be used or accepted if women are not encouraged, in this case, to use the offered services. For the service or the use of service to be integrated further in the system, if a patient has a condition that requires help and referral, a major role was played by the e-health directorate, because the work of the mobile clinics and all examinations were integrated in my appointment. Every patient is registered and included in the system, and all further needs will be recorded also for this patient. She or he is no more isolated. As Professor Anna said, we made a rapid assessment while developing the model. We purchased adequate equipment, supplies needed, everything that was needed not to further overload the healthcare system. We started straight away with field work. The role of Red Cross was to mobilize the vulnerable categories, particularly, which included work with municipalities, centers for social work, as GPs, social media, on social media, sharing information, and of course, women NGOs. What else did we do? To be able, the key service that was provided, I forgot to mention, was the service for prevention we have screening in our country. However, the activities that are additional to the activities that already implement for prevention of cervical cancer activities and early detection of cervical cancer. It is a condition, I believe, we are all aware, a malignant disease that with early detection could be prevented. This is the only type of cancer that could be prevented with early detection. That's why we implemented a campaign, national campaign with the ministry, and directly at local level with the communities where we worked. The manner of our operation will be further explained by other panelists. However, what we saw in the field and the women examined, apart from the great interest, as my colleague Jovanka said in the video, for such services, there were women that 5, 10 or 15 years have not attended gynecologists at all. So these services are of extremely great importance. What is our goal? Today we are here to mark the closing of this project, the completion of this project, unfortunately. However, also the success and also I mentioned, and my colleagues, panelists will mention what we have done. We saved lives, a number of lives, improved quality of life of women and girls and their families, and thus for our society in general. We need to recognize the role of women. This is one key point for which UNFPA is fighting. All these results are motivating for us to continue to fully integrate these services in the national healthcare system. What I wanted to say is that we here today, or on 31st of March, the activities financed by this project will be completed. However, UNFPA, out of its budget, will allocate funds so that in the next few months, the activities will be continued exactly for the great interest. However, the ministry on several occasions promised that they will start to integrate these services into the healthcare system. This model could be, of course, expanded with other types of services. What I wanted to say is that partnership is number one, and we cannot do anything alone. We need joint efforts. Thank you. Thank you, Dr. Aphrodita.
Excellent messages when it comes to the extension of these activities. I hope that these partnerships will continue and that the services offered by this model will expand. Now, here we have the president of the Macedonian Association of Gynecologists and Obstetricians, who was a key partner in the implementation of this project. Part of the activities were mentioned in the video. I know that they were working on a daily basis on organizing the activities before they were launched. They were conducting trainings and making quality assurance of the services that were being provided, but they were also involved in other issues and resolving dilemmas. That's why my question would be, could you share with us some of the details when it comes to organizing the work in these healthcare teams, as well as the impact of this activity on the field? Thank you for your question. When I was coming this way, before answering the question, I remembered an event that took place 25 months ago, when together with the United Nations we presented the report on perinatal mortality in Alexander Palace Hotel on the 27th of February, and as guests we had Dr. Hars Kluge and Nina Berzuli. And while we presented the activities, at the end, when we hold the press conference, the only question, there was only one question about perinatal mortality, and everybody was asking about COVID. And after 3 days, there were no events. We were under lockdown. Some of us recovered from COVID. Some of us, and many of us, were vaccinated. Some of us 3 times, like me personally. And we entered into a system that does not differ much from the one 25 months ago. And many of the things in our lives have changed. One of the things that changed was the access for women, the approach to women, especially our category as gynecologists. Our university clinic was a COVID center, so we reduced the number of surgeries, and we felt the need that we should get involved with our work outside of the clinic, to work with patients who, with or without COVID, had difficulties to access these services. So we had talks with UNFPA, with Dr. Afrodita, and the resources that we had, like Afrodita said, the vehicles that we had were used for this purpose. The idea was accepted by everybody. We had coordinating meetings out of the way, and we developed a protocol on how this entire system will function. Not to focus only on the prevention of cervical cancer, but also to include all the services. So we had a team of experts with representatives from the Ministry of Health, from the Macedonian Medical Association. So they designed these special brochures for raising the awareness among women. So this project had 2 elements which are very important. One is that it works realistically with patients in the field. We have 60 doctors and 60 nurses in the field, and I don't know how many volunteers from the Red Cross and personnel from the Ministry of Health. So this is a really complex process, and I would like to thank everybody who enabled this to work without any problems. And there is one segment that refers to health education for the population in the rural areas. So we looked in the My Appointment system for the areas where there are lack of doctors. The beginnings are always difficult, so we trained our doctors how to work in these mobile clinics. So you were able to see this on the video. They were performing pap smear and ultrasound, and they had time for a talk. So it looked like it takes place in any other clinic across the country. So this was a success of all of us, of UNFPA and of the ministry. And what is really important for me, because I mean, on planet Earth there are physical laws, and one of these physical laws is the inertia. So it is really difficult to move things from zero ground, but I hope that UNFPA and the ministry will continue this support in the future, because something that moves and goes in the right direction should not be discontinued. It's much easier to maintain it than to relaunch it. The members of the association, I wouldn't like to take too much of your time because there are also other panelists. I mean, we established a new practice of transparency, informing everybody from our mailing list, and also to enable this for everybody from across the country. But due to logistical reasons, most of the people that were engaged in this were persons living in the north region of the country, close to the capital. But we will continue in the other regions as well. What is really important is that they learned the system, they embraced the project, and the evaluation received from the patients in the field showed that we had elderly women, so we included another activity, educating also younger categories. So in these areas where these mobile clinics go, we have organized educational courses for the young people to understand the importance of prevention as well as the importance of protection against sexually transmitted infections. We made to Brvenica, Vrapčište, Češinovo Blešovo, Sveti Nikole, Čaška, and many other places where there is a real need. And I think that this also opens another perspective for cooperation with the ministry, and I expect support from the UN bodies so that we can continue this project, so that it can cover the larger group of female patients who do not have their personal gynecologist and for which these services are unavailable. And in the end, I would like to mention one more thing. As part of the activities for medical checkup for non-pregnant women, the brochures included information about the checkups that they need to undergo. What are the symptoms of COVID-19 in pregnant women as a more at-risk group? What are the recommendations for victims of sexual violence and where to be referred, or victims of gender-based violence, and with an indication of the hotlines that are available to them. And there is another segment. There is a possibility for these patients to be registered to receive a health insurance by contacting the regional branches of the health insurance fund in case they do not have health insurance. So there were several activities in parallel. I think that it was a good start. Let's hope that COVID-19 will disappear, although nobody can give any prediction at this point. I would like to thank once again to everybody who made their contribution. The idea was wonderful, also involving the Red Cross, and bringing this project to life. Thanks. Just one short question. What was the feedback from the patients who received these services? I, as a doctor, know that there is a category of patients that are hard to reach, and this model reached different categories of patients with different types of services. What were their reactions? I was in the field once, but we receive regular information from colleagues. There were patients who haven't seen a gynecologist for 30 years, and it is really difficult for them to decide. They will ask, what kind of clinic is this, what kind of examination, and so on. But once they get the trust, when we started moving from one place to another, there were patients coming to us who asked for a medical checkup. But it was obvious that the interest among the patients was very positive, which was also seen from the feedback from the evaluation sheets. Thank you. Our third panelist is Dr. Sanja Sazdowska, advisor from the Ministry of Health.
Sanja, it is a fact that COVID-19 pandemic hit all healthcare systems, including us. It was faced a great challenge. We faced a number of people that were diseased, challenges related to vaccination, its organization. At the same time, there was a need to provide services for sexual and reproductive health for our patients. What was your response as Minister of Health? Thank you, Dr. Anna. Thank you all guests. First of all, let me thank for being part of this panel, and let me express my gratitude, my pleasure to be able to speak about women's health, including innovative approaches for its improvement. To go back to the question, Ministry of Health follows all events in the region and on global level. And of course, the long-term cooperation with UNFPA was further strengthened during the pandemic's time, which led to new initiatives and new partnerships, as in the case with the innovative services for sexual and reproductive health based on mobile gynecological clinics. We, as Ministry of Health, are particularly proud that we have identified a new model of services that reaches women that really need it. Left behind, the women who could not reach these services for different reasons. One of the reasons that we identified is unequal allocation of distribution of gynecologists in the communities, but also many other factors. Mobile clinics managed to leave no one behind, leave no woman behind in the delivery of healthcare services for sexual and reproductive health. Preventive examinations save lives. We all need to continue to invest in prevention. That's what the Ministry of Health is committed to, and for long years it has invested in prevention program with a focus on sexual and reproductive health. The development of modules, I need to mention this as my appointment and the Health Directorate incorporated the mobile gynecological clinics for adequate reporting in the National Healthcare Information System, which shows that it is on top on the agenda of the Ministry of Health. Services for women health. COVID-19 will disappear, we hope. However, we will continue to need innovative methods and approaches to reach to every woman that this right was neglected to reach healthcare services. We have a model that is operational, and we hope to work on its full integration in the national healthcare budget with the support of our long-term partner, the UNFPA, and other partners and associations. And for this, we will need, of course, time, and we need support and new partnerships to bridge the period that in which we want to find a systemic solution for this challenge. Feedback is very important from the evaluation lists filled out by the outpatients in the field, women and girls that received services in the mobile gynecology clinics. And they were honestly very motivating to be persistent, to stay on our path to our goal to leave no woman behind. Once again, I would like to use this opportunity to mention that we have another example of an innovative approach for healthcare services during COVID-19. We know that from the start of the pandemics, when we compare the numbers of women that responded to the call for GPs, their gynecologists for pap test, we have a decline in 2021 compared to 2018, 19. These are the data received from the Institute for Public Health, and as a response to this situation, the Committee for Early Detection and Prevention of Cervical Cancer consistently work on the development of a new innovative approach in the screening of cervical cancer offered by the portal Screening MK, together with our colleagues with the eHealth Directorate. And now every woman, starting from this year, every woman from 36 to 46 years of age can realize their rights to free of charge pap swabs with their. We will hope that we will manage to achieve our goals in the improvement of women's health and finding ways to bridge the period from the completion of this period to the finding of systemic solution. Thank you, Sanya, for the response. I'm sure that it is great that you keep the statistics for number of patients covered, but I'm sure that this model has not covered only 1,000 patients, but encouraged thousands more to think about preventive examinations, raise their awareness about sexual and reproductive health, and many other activities that were implemented. Let us not forget the activities for gender-based violence, other educational discussions for the youth. They will encourage not only healthcare workers, but only others to be more actively involved in this field. Now, our fourth panelist is Mrs. Lydia Steryov, head of the Department for Social Inclusion in the Ministry of Labor and Social Policy. It is a fact that social welfare and health are very closely interrelated, and you, as part of the ministry, was a key partner in this complex model. Could you share the importance of this multi-sectoral cooperation, and what was your part, what was your responsibilities?
Thank you, Anna. The multi-sectoral cooperation always is a precondition for success, and this is the basic principle that we are guided by in our work at the Ministry of Labor and Social Policy when it comes to the development of policies channeled towards victims of family violence and gender-based violence, elderly women, children, and persons at social risk. The Ministry of Labor and Social Policy in this innovative project was involved through the social work centers, and the social work centers are dispersed throughout the country, 30 of them in total, and they cover both the urban and rural areas. What was the basic role of the social work centers? It was to identify women, because those who are in the system of social protection or who exercise some rights to social protection or some service from the area of social protection and who need this type of preventive healthcare services related to sexual and reproductive health of women. Together with the team of volunteers from the Red Cross and the experts from the Social Work Center, we performed a mapping of these women who were later referred to use this preventive healthcare service. Apart from identifying and mapping women, they have also designed materials that were intended for the women victims of gender-based violence, in terms of recognizing the signs, where to report this as a problem, to which institution, and which are the specialized services that could be used by women who are victims of family violence and gender-based violence across the whole territory of the country. In the end, I would like to emphasize that the mutual cooperation within this project of the Ministry of Health and the social work centers, as well as the healthcare institutions, together with UNFPA and the British Embassy, will also conduct another project for protection of victims of gender-based violence. Through this project, in this project we have several activities, but one of the key activities which is really important to emphasize is the development of the joint protocol for cooperation between the relevant institutions. These are Ministry of Health, the Ministry of Labor, the Ministry of Education and Science, the Ministry of Interior, the Ministry of Justice, and the civil society organizations when it comes to working with women who are victims of family violence and gender-based violence. With this protocol, we are finalizing our multi-sectoral cooperation. All of the institutions form part of this chain, and they have all their individual responsibilities, but the interconnection of the institutions is a really important element. We are always focused to pay attention to the victims. We as institutions, as parts of this chain, should act both in terms of prevention and protection, and we should not allow this chain to be broken, because if it gets broken, women who are victims of gender-based violence will not get protection. That's why this multi-sectoral cooperation is very important, and it's important to relate health services to social services in order to provide adequate support and protection of women who are victims of family violence and gender-based violence. Thank you. Yes, of course, the multidisciplinary and multi-sectoral approach in partnership is very important, and it's really important that the voice of these victims, not only during the COVID pandemic, but also under normal conditions, it is difficult to reach the institutions. It's important to hear the voice of these women and girls, and I hope that there will be sustainability and that this system will continue. The Red Cross of North Macedonia for 77 years has been in the front lines when it comes to emergencies. Today, our last panelist is Ms. Bijana Żurowska, who works on health and preventive programs in the Red Cross, and I believe that your teams were engaged since day one in the response to this pandemic, and that's why it is no surprise that the team of the Red Cross was involved. Can you tell us how the work of the volunteers was organized? What were their tasks? And maybe to say something that was not asked. First of all, I would like to thank you for inviting me to attend this panel discussion, to greet the other panelists as well as the attendees, both here and online. As you have said, for 77 years, the Red Cross is a faithful partner of the government and of the NGOs who support the vulnerable population, both in crisis situation but also in peaceful times. That for this project activity, the Red Cross through its voluntary teams provided support when it comes to logistical preparation in the field, then also administrative support to the mobile clinics, as well as it assisted in informing the local population by disseminating flyers and publishing information in the media. So all these activities were necessary for the work of the mobile clinics and for their operation. The Red Cross has a wide network of volunteers across the country, and for this activity we have engaged the volunteers who were part of the community in those communities where we had these mobile clinics. So we use the volunteers who live in those municipalities in order to reach more easily to the population, to spread the information and to gain their trust. Also, as the other panelists have mentioned, we cooperated with the GPs, with the social work centers and with other local NGOs in order to spread the information about the work of the mobile clinics more quickly, and these organizations help in the mapping of future patients. We wanted especially to reach the vulnerable women who have difficult access to these services for sexual and reproductive health. That's why the Red Cross opened phone lines, and these information were published in the media, so women could call these phone lines and make an appointment for a medical checkup. So we had volunteers from the Red Cross who were making the appointments by phone, and they were updating the information, updating the list of patients that have a medical appointment. And what is really important to emphasize is the role of the local self-government units in this process of cooperation. The secretaries of the municipal organizations of the Red Cross, they have established contact with the mayors of the municipalities, and they provided support in this entire process by giving approval for the site where the mobile vehicle would be stationed. Also, they provided infrastructure in the field, premises for keeping the equipment, and they have additionally supported us in informing the local population about the mobile clinics. And as an important feedback that we received from our volunteers in the field is that they were really happy about this, as it was said by the panelists. I mean, the patients were really happy because some of them for 5, 10 or 15 years had not attended such a medical checkup, and they were really happy that this was provided in their local community for the first time, to get this type of service and to have it free of charge. They were satisfied with the approach of the doctors, with the support of the volunteers, and the satisfied patients have spread this information into the local community, and this contributed towards an increase in the number of interested patients. So that's why the project will continue in the following 3 months. Thank you, Biljana.
Thank you, Biljana. Maybe this was the greatest challenge in the organization, Dr. Afrodita knows, to make the patients, how to make the patients that for certain reason, geographical, family and other reasons, did not come for preventive checkup, and it was very important in this organization to reach to such patients. Dear panelists, before closing remarks or comments, messages in the end, I would like to thank you for sharing what you have experienced in the implementation of this innovative approach. We saw that this model includes a number of partners and it is feasible, and I hope it will be repeated to provide for wider coverage of services. Improving healthcare condition is not an issue of importance for the healthcare system. We need to engage also national, political, economical systems to solve certain conditions or issues, to deal with certain issues that will further on realize the improvements in the healthcare system. Definitely there is a need to overcome the gap to full integration of these services in the healthcare system, and I hope that UNFPA and other partners present here in future will also continue to promote such multidisciplinary services, and will continue to develop strategical services, because in this way we will only achieve universal healthcare coverage. I will ask you now, in the order you address the public, to close today's panel discussion. Thank you, Professor Anna. It is difficult in one sentence to say what I want. I will try to say it in two. First of all, as my dear colleague Patricia Di Giovanni said, if we are all committed to leave no one behind, and this is the model that truly reaches the people left behind, then I would like to call upon all who could support this model until it becomes fully integrated and undertaken by the state institutions to contribute to it, so that these services could be further provided and expanded for services that women need, because we see that women die and their lives could have been saved if the services would have been closer to them. This is number one. And number two, my deepest gratitude to all partners, because major efforts was put to develop such a model. Particularly, I would like to thank my colleagues from the United Nations, the Office of the Resident Coordinator of UN, and my incredible team from UNFPA that day and night, 24/7, COVID, not COVID, worked to develop this model and go out in the field. Thank you. It is difficult to sum up everything in one sentence. In principle, we worked hard to cover other categories. I forgot to mention the inmates, the sexual workers, other partners. We also cooperated with other ministries, with Ministry of Internal Affairs, Directorate for Sanctions. What is very important for me from the aspect of my personal experience is that sometimes men can think that some things could not move in Macedonia and get agitated about that. negative energy for the things not moving forward, but every idea that is quality for which you will provide adequate partners is obviously achievable. Thank you. Thank you. Before this event started, Professor Anna said that she told me to give a closing remark, closing comment. To be honest, I work in the ministry where majority are women. I work on women issues. 17 years, 17 and a half years, this has led me throughout my life. The saying of respectful Madeleine Albright, I will read it in English to be more clearer and cite it. Сметам дека што треба да
each other, and my motto is that there is a special place in hell for women who don't help each other. Ви благодарам.
I would share a brief message that with joint approach, multi-sectoral cooperation, we will always give adequate response in the recognition, support, and protection of women, victims of family violence and gender-based violence. Thank you. Biljana, just briefly something that we can conclude together from the panel discussion and all the activities that have been implemented in the field by mobile clinics at the prevention, checkup, save lives, and that also multi-sectoral cooperation is a key factor for success of such project activities. And in the name of Red Cross, I would like to say that we are truly proud to have the possibility to contribute to the implementation of this important initiative. Thank you very much. Thank you, thank you. Thank you for your attention of all panelists, that we can have more questions after the second panel discussion is completed, in case anyone has further questions. Thank you, our dear panelists, our moderator for the first panel today, for their exhaustive and informative discussions in the provision of continuity of the services for sexual and reproductive health for women and girls throughout our country. In continuation of this program, let us see part of the activities of the World Health Organization under this project. Years ago, on 8th of May 2020, WHO celebrated 40 years of the extinction of the smallpox. The irony wanted this important jubilee to be under the shadow of the pandemics, COVID-19, that fully shake the pillars of the modern world civilization. WHO, in its report, stated that the smallpox were the only disease that was extincted throughout the world fully. Before its extinction, this disease was continual threat during at least 3,000 years of man history and killed 300 million people during the 20th century only, or about 4 million a year. In the support of these incredible facts, UNICEF assesses that without the vaccine against smallpox, only during the 90th years of the last century, this disease would have taken about 5 million lives, or 13.699 on a daily level. And now, think about all news during the 90s, instead about usual triviality, every day to have been focused on the reporting of saving of 13.699 lives as a result of the successful vaccination. This success story and the stories similar to it show that the invention of vaccines is one of the major technological achievements in the modern civilization. Children diseases that were part of everyday life just one generation ago today are rarely present, or they are not existent as a result of these scientific discoveries. The invisible monsters that killed so many people were finally overcome and defeated. Apart from this fact, many people are not very well acquainted with the vaccines, and some of them develop reluctance or resistance, even among healthcare workers. The vaccination against COVID-19 in North Macedonia is still not on its satisfactory level, and we need much more effort to achieve the goals on the national vaccination plan. Before we continue further in the second panel on this topic, let us present a brief UNICEF video on this topic.
Одлука е збор кој носи решенија.
Процесот на одлучување не прати цел живот.
Джеја Мајран ка чин че вендими мостиет ветјак.
Тоа што ме движи напред при донесување на одлука е размислувањето на многу чекори однапред, што е целта.
Është dëshira për të pas sukses dhe dëshira për një të ardhme më të mirë.
За да донесам една одлука, прво ги разгледувам сите опции.
Кога не знам, тогаш сакам да се консултирам со експерти.
Vendimet e sjellura mundohen t'i bazoj në diturin që mund ta kapi.
За мене не постои дилема.
Вакцините спасуваат животи.
Вакцината е нашиот спас од заразните болести.
Не jet балафачуваме ме шум лој вендимеш, мир по пркато вендим и еми та сигурт.
Прашај пред да предпоставиш, верувај на фактите.
Сега почитуваме.
Dear guests, we have the pleasure to invite the participants on the second panel for today, titled Strengthening Immunization Through Digitalization and Capacity Building and Addressing Hesitancy. They will discuss about strengthening the immunization through digitalization, by strengthening the capacities and by building trust in vaccines. The moderator of the discussion will be Professor Alexandra Grozdanova, Chair of the Immunization Committee at the Ministry of Health. The floor is yours. Good afternoon to everybody. It is a real pleasure to moderate the second panel of today's event. The panel is titled Strengthening Immunization Through Digitalization and Fighting Reluctance and Hesitancy in Terms of Vaccination. It is a great pleasure to have the panelists today, Patrizia Di Giovanni, head of the UNICEF in Skopje. We have here also Goran Goczynski as a representative of the WHO, and when it comes to education and digitalization, I will speak with my dear colleagues, Professor Katerina Stavric from the Center for Family Medicine and Dr. Kristina Stavridis from the Institute of Public Health. Allow me briefly, as an introduction to this panel, to add upon the data that were presented in the introduction when it comes to the figures and the efficiency of the vaccines in the past and today. These data that were shared about the eradication of smallpox show without doubt that history tells us that vaccination is one of the biggest technological and medical revolutions. And if, according to a quote from an eminent professor, Steven Plotkin, no other medical intervention, neither the discovery of antibiotics, has saved so many lives as have done the vaccines. Unfortunately, today we are talking about this contradictory situation that we have. Despite the effects of vaccination seen in the past and seen today, we are faced with the moment of skepticism, distrust, a lot of misinformation or fake news when it comes to vaccination. In the past 2 years that we have lived in this COVID pandemic, we have seen a deterioration of this situation when we should have returned to some basic medical confirmations and medical facts. For example, if you have an efficient tool like vaccine, no disease can get to such a point as this. But unfortunately, what we have seen and what we are here to discuss today is that we should repeat these things. Probably the facts from history haven't learned us enough. So in 2022, we should speak more about the benefits from the vaccines, especially what is the most difficult topic as healthcare workers, that a large portion of this mistrust towards vaccines is present among the health workers themselves. In the past period, a lot was done in the field of immunization. I would like to thank the partners such as the WHO and UNICEF. When it comes to immunization, previously on national level, we have modernized the calendar. Our state has one of the most up-to-date calendars of immunization. We have introduced all the recommended vaccines to have as mandatory vaccines, but unfortunately the coverage is not on the level that is desired. That's why research was conducted as part of some projects and studies. We wanted to see the reasons for such mistrust and to see the reasons for such a low coverage. Unfortunately, in the past 2 years, although I must say that no vaccination point was closed, the vaccine was available at any time, but unfortunately we have reduced coverage. This was pointed out by our partners, by the WHO, that it is normal to happen in times of pandemic, but what is really important is to not is not to allow this trend to continue. That's why we are here today in times of pandemic. We have excellent projects that were undertaken. I would like to thank once again the Ministry of Health and the WHO and UNICEF, because only by identifying the right problems you can know where to intervene. That's why today we will discuss on this topic. My first question today will be to Patrizia Di Giovanni, head of the UNICEF in Skopje. Within a joint project, there was a study to identify the factors and what are the decisive factors for the low uptake of MMR vaccine. In 2018 or 19 we had an epidemic of measles because of the low coverage of vaccination. Exactly with this vaccine, there were obstacles on both sides, on the supplier and on the demand side. So I invite you to share your insights from this study.
Thank you very much, Professor Alexandra. I think it's really great that we're talking about smallpox and how we've managed to eradicate that. Before I go into the studies, just some personal reflection is that this is not just a one-off situation, because we've managed to almost eradicate polio in the world as well. Polio through the same exact mechanism. Vaccinations work, we've seen this now 2 times, because polio is almost eradicated in the world. There's only 2 more countries that we're waiting to see if there is polio. But in this country we have eradicated polio. So I want to re-emphasize, vaccines work, not just as a one-off on smallpox. We're seeing the same thing happening for polio. We're also about to see the same thing, I hope, happening for measles, mumps and rubella. And this is the main vaccination for children, but we have a regime of vaccinations for children. As Professor, you mentioned, part of our contribution, we've done a few things as part of this project, but part of our contribution was to do some extensive studies on what we call knowledge, attitudes and practices. Not just of parents in terms of the demand, but also of health workers. What's going on there as well? Health workers are trusted in communities, so what's happening there? And if I can just look at the results a little bit. We know this, and I think we see this in the social media quite a lot. We see this all over the place. There's a lot of misinformation out there. When it comes to our children, we care so much that we don't want to make mistakes. We get really scared. What if something happens to my kid according to this article that I just read? And I think there's a lot of misinformation out there, and we're seeing that there is a fear of what vaccines are, what they do. And I've got to say that part of the factor is that we don't see a lot of the diseases in the community. 68% of children continue to be vaccinated. That's more than half. It's not enough, but let's just say that so far, and really thank goodness, so far, we haven't had a measles outbreak since 2019. When we see the effects, we will see again in the community what is the reality of this disease on our children. So parents are worried about the truth, they're worried about what is the reality, what are the side effects, can they have confidence in these vaccines? They are reading quite a lot of things, and there is often not a lot of judgment on what do they call fake news? I think that we call that now in 2022. That's a term we didn't have 3 or 4 years ago. But I think we all know what that means. How do we, as parents, determine what is fake news, and how do we get enough scientific information to make informed decisions without ourselves having to have a PhD in these things? This is complicated science. So who do we trust? We also asked the health workers. And the health workers, although they know quite a lot more, they reported that they are often worried about the effects of parents maybe getting angry, getting nervous, that health workers, they don't feel they have the confidence to talk about the risk of vaccines. And so as we move forward, this is going to be some of the things that we're really going to have to look at. Because frankly, 68% is not good enough. Now, I know that we maintained, as you said, Professor Alexandra, we did maintain, no vaccination centres were closed. In the last year, I went and visited a few of them, and we had quite a few. I was very happy to see that there were parents. Were there enough? No. So we have to build that confidence again. Training health workers on how to communicate effectively and with confidence, how they themselves can identify fake news from scientific news, and also giving parents much more confidence in knowing themselves. I just want to hit you with some statistics because I like statistics, I like science. There are 14,000 children right now unvaccinated in this country. And that is, I'm afraid, this keeps me up at night. That is a disaster waiting to happen. It's something that we need to avert with urgency. It's almost the next emergency, guys. It's a highly contagious disease. It's a terrible disease in terms of measles. And so we need to really address what they're calling the infodemic, not the pandemic, but the infodemic, and really look at how do we get scientific information which is easy to understand out there. So I can go on a bit more, but I really wanted to talk about what is keeping me up at night, and that is getting these childhood vaccinations back to a very high level. This country has a very good track record quite a few years ago, so it can be done. And I think that that's very important. We've seen what measles can do, and in terms of it feels like we're going back to almost normal pre-COVID. I really want to emphasise we can't go back to pre-COVID normal when it comes to children's vaccine. We've got to come back much, much better and at much higher rates. I'd like to see 100%, but I think I might settle for 90. I might settle, but I'll still continue harassing everyone until we get to 100%. Thank you very much.
Thank you.
I hope I was brief, but to the point.
Thanks a lot.
Dear colleague Kuczynski, representative of WHO office, I would like to discuss with you the activities that the World Health Organization implemented in the part related to capacity building, particularly the theme for digitalization. Could you briefly explain the activities of the WHO in this area? Thank you very much, Professor Grozdanova, dear panelists, dear guests. I will start my address continuing from where the previous panelists finished. WHO recommends minimum 95% of vaccination to consider we are successfully protected as country. So our target is minimum 95%, which is within the, of course, your view. As we said before, immunization from historical point of view is one of the most successful public health intervention, protecting the children and adults and saving thousands of lives every year. However, the pandemic's cost of COVID-19 in our country, although routine immunization was not discontinued during the process, the activities related to routine immunization were decreased, and at the same time we saw that according to the Ministry of Health data and Institute of Public Health data, the rate of COVID-19 vaccination is low, about 42% of the total population. This is particularly important because every disruption in immunization services, even for a brief period of times, could result in outbreaks of new pandemics that could have been prevented with the simple process of vaccination. healthcare workers play an important role in about the acceptance of COVID-19 vaccination. Their knowledge and attitude are important determinants not only of their own vaccine uptake, but also of their intent to recommend the vaccine to their patients, and hence directly contribute to increasing the vaccination uptake. At the beginning of 2022, the WHO implemented 2 studies for the insight in the attitude, considering also the attitudes of healthcare workers and general public related to COVID-19 vaccination, and the preliminary results reveal that when it comes to the COVID-19 pandemic, most trusted sources of information are healthcare workers. They are most trusted by the population. Therefore, it is vital that healthcare professionals who are working in immunization teams to be confident, knowledgeable, and brought up to date with relevant information. To be able to achieve this, we need good foundation and regular training and continuous training. WHO in the past 2021 organized key training events for healthcare professionals for prevention teams, but in general for healthcare workers in primary healthcare. Because of the COVID-19 pandemics, these trainings were implementing using digital technology, innovative principles to quickly, easily reach the information from the professional teams to healthcare workers. That's why we developed a platform in cooperation with the Ministry of Health, trainings или обуки, здравство МК, available to all healthcare workers on the territory of our country. All training courses are free of charge, are accredited by the medical chamber. As regards the joint program, WHO supports empowering the frontline immunization workers and immunization managers through developing and delivering electronic training by additional electronic training called immunization in practice and mid-level management that are standard trainings of the WHO, however tailored adapted to the needs of our national context. More than 400 people participated in these trainings, where they could in detail acquaint themselves with the information that we will additionally share and that the further panelists will explain. The knowledge gained from these courses help healthcare workers to improve the quality of immunization services, share innovative vaccination practices with their peers, and promote vaccination uptake to their patients. Combining the use of digital tools with face-to-face education is an approach that shall be further developed for strengthening the healthcare workers' capacities in the area of immunization, but also in general in all healthcare aspects. WHO has supported the introduction of innovative digital tools in the health sector as through support of the National System for Electronic Records, My Appointment, or adjustment of the system for keeping records of COVID-19 vaccination, and also for the development of the web portal Vaccination MK, Vaccinația MK, and the patients could receive their appointments for vaccination and then also receive national vaccination certificates. In the process of innovative or use of innovative digital practices, the national system used flexible method algorithm of automatic appointment of patients for COVID-19 vaccination in the first 2 phases according to the national vaccination plan, or coded or scored the different characteristics or features that were defined in the system. Improving the data collection based on digitalization and as regards to the vaccination against COVID-19, and at the same time, the same could be applied to routine immunization, opens new possibilities for better monitoring, coordination and planning, and first of all, adoption of decisions based on evidence. The modernization of the immunization process helps to decrease administrative load, administrative responsibilities of healthcare workers, enabling them to dedicate more time to care for their patients. In the end, I would like to thank the Ministry of Health, all professional associations and also all agencies of UN for excellent cooperation and excellently organized activities under this project. And I hope, I'm sure, that these activities will not be completed here. We will continue further in the implementation of modernization, digitalization of immunization, and also development of capacities for improved healthcare system in the country. Thank you. Thank you, Goran. In continuation, several times we mentioned education of healthcare workers. We mentioned the importance of accurate data. And Mr. Koczynski mentioned the WHO activities. Dr. Stavric, with you, we will go in further detail. You participated in these trainings. You directly experienced the benefits based on the analysis on the needs of as regards communication of healthcare workers. They formerly lacked communication. We live in a different world, different ways of communication with parents, and this tool is very important for healthcare workers. In this context, several trainings were implemented, materials were developed. I would like to hear your opinion and also the audience. What was actually done in this part and what is your view? Do we need to formally, these trainings and modules, make part of undergraduate or studies of healthcare workers? Thank you. In 2021, all healthcare workers faced, because of COVID-19, with serious challenges. On one hand, about regular immunization, and on the other hand, about starting and implementation of COVID-19 vaccination. These trainings certainly came at the right time, and the goal of these trainings, and we held really a great number of training courses, the goal was to strengthen, to improve the knowledge, the skills of healthcare workers, because particularly the focus was placed on interpersonal communication with patients. We saw that this is a key point that will enable both parents, when we talk about routine immunization, and the citizens also, to receive vaccines against COVID-19. It is very important because it leads to building trust in immunization and the healthcare system as a whole for its implementation. These trainings, one group of trainings, were dedicated to healthcare workers that work in the field, in the implementation of the vaccination process, and all prevention teams attended these trainings. There was a separate training tailored, adjusted to our context for the managers of healthcare centers, because they are very important in the organization and implementation of successful immunization process. COVID-19 vaccination put us in front of a significant challenge. In a brief time, a large number of healthcare workers needed to be mobilized and educated, receive specific knowledge and skills for individual vaccines. And this online platform enabled this. A large number, almost all healthcare workers, including students, young doctors, to attend this training, to complete this training and be confident in the information they share with the citizens. I would like to mention the education teams involved in these trainings. We were continually available both on phone for consultation with our colleagues and physically present at the places where COVID-19 vaccination was implemented, because this was very important to support and build the trust in healthcare workers who implemented the vaccination process. Healthcare workers truly accepted greatly these trainings. They saw the benefits of online trainings. It is easily accessible. Healthcare workers can anytime during the day access the website. And of all healthcare workers, not only those directly involved in the immunization process, also others, including young doctors and students, because we all play an important role in information sharing, information related to immunization. However, what my colleagues also said, part of these trainings were organized with physical attendance, and my colleagues from preventive teams stressed the need for such type of workshop with physical attendance on regional level, because in some way it is easier to detect problem and share positive practices that could be used, and strengthen the regional cooperation of preventive teams, which is very important in this period. Future plans, absolutely. Particularly now with the changes where young doctors, after acquiring license, have obligatorily 6 months to implement healthcare services. So in vaccination centers, there is a need to include this education in undergraduate study plans when they join prevention teams. About the managers, while the accent was on the need such trainings that were developed to become compulsory, obligatory training for all healthcare workers that start working in preventive teams for immunization. Good foundation for acquiring of knowledge, attitudes, skills, and then together with more experienced colleagues of prevention teams to upgrade their knowledge. As a conclusion from all these trainings that were implemented, there is a need to include this in formal medical education and repeat in every 2 years as a compulsory part of continual professional development of the team, particularly of the teams engaged in immunization process, prevention teams. The ultimate goal, I agree, is to return to what we have, 95% vaccination coverage. Thank you.
Thank you, Dr. Stavric. We completely agree that the education should not be a one-off step. in any field, but when it comes to immunization, maybe the COVID pandemic has shown the importance, how important it is that health service providers are well educated, to have reliable information, to have self-confidence when it comes to interpersonal communication in these areas here in this region. This was seen as something that does not require formal education, but we have seen that a lot should be worked in this segment as well. We should be more present and more loud, and this process should develop in continuity. And I agree that when we have really educated healthcare workers who have self-confidence in what they work and in what they say, we can see the benefits from the implementation of the immunization. Dr. Stavridis, with you, we will discuss a bit about the digitalization. The COVID pandemic has provided new opportunities. We mentioned the online trainings. Maybe there will be an everyday tool in the future for cooperation as well as education. Therefore, the digitalization of immunization got accelerated, although it was underway even before the pandemic. Tell us your opinion on this, and how much will the digitalization facilitate our work and facilitate our decision-making process? Thank you, Professor Grozdanova. I will start by saying that the digitalization of the immunization and its integration in the electronic healthcare system began several years ago with the implementation of the module for preventive healthcare, with the purpose of having electronic records of the data on immunization and systematic medical checkup of children. This enabled quicker and easier access to data about the process of vaccination and the digitalization of data. Step by step, we are replacing the manual introduction of data and the card boards with the digital repositories. With a module for preventive healthcare, we record all the vaccines that we have in the national storage in terms of the lot, series, number, and quantity that are distributed throughout the vaccination points. Vaccination is available in the birthplaces, and also this is later enabled through the single identification number, and persons without identity, also called phantom persons, can also be recorded in the system of immunization by being assigned a number from the relevant institutions. In this way, we enable all children who have received vaccine to be introduced in this system and their vaccines to be recorded and available in their medical file, electronic medical file that could be available and accessible to all the doctors that are interested. In 2021, with the support of the World Health Organization, we managed to stimulate and motivate the preventive teams in the vaccination points to perform retrograde introduction of data of all children that received their vaccines according to the calendar of immunization in the past few years. In 2021, we have also organized visits of the vaccination teams and vaccination points throughout the country in order to present the use of the electronic register of immunization and the possibilities that it offers. Now we are working on upgrading this register with additional records, such as the possibility for creating certificates of received vaccines that will be used for enrolling children in nursery schools and schools. And also we will involve the pharmaceutical wholesalers in order to facilitate the process of distribution of vaccines and exchange of information with the Ministry of Health. And we will initiate the use of a barcode reader in order also to make the introduction of the vaccines in the system much easier. By putting into use and by using the electronic records on immunization, what it enables? Well, it enables us to monitor the use of vaccines and appropriate distribution and also timely procurement of new vaccines. And it is really important that the monitoring and control of vaccination coverage in real time that is enabled by this system, we have the possibility to identify the vaccination gaps in order to take timely measures to overcome them. In 2021, by upgrading this module with support of the WHO, we implemented the digitalization in COVID vaccination in total. It means that from the process of planning to the step of creating our vaccination certificate, the module was upgraded continuously according to the needs and demands of the ongoing situation. First of all, we needed these vaccination certificates in electronic form. Then it also assisted in the process of vaccination itself. In the beginning of the COVID-19 vaccination process, we launched the Vaccinația MK website, which enabled all citizens of the country, but also residents, people who reside in the country, to register their interest for vaccination. So the system enabled us to invite these people by SMS with the exact date and vaccination point that they should go to. And later it enabled us, as I have mentioned previously, to issue the national vaccination certificate. First of all, for the 2 doses, and also it was upgraded for the booster dose when this booster dose became available. The digital certificate is available online on the portal Vaccinația MK, so by signing in it can be downloaded by the holder of the certificate. It also allows you to download the Common Pass and the EU digital certificate. I said that the module was upgraded continuously, so with this continuous upgrade it enabled the vaccines that have been administered abroad to be registered and to issue a certificate with vaccines that have been administered abroad. These digital interventions, as well as improving data collection through digitalization of the immunization, as I mentioned, gives us possibility to monitor the used quantity of vaccines both for the regular immunization and for the COVID vaccination, and it enabled us to have appropriate planning based on evidence, and it will increase the immunization coverage rate. Thank you. If you allow me, just a brief comment. Maybe the digitalization due to the COVID vaccination showed the power of the digitalization of the process of immunization itself, and it showed how easy it is for us now to use these applications when we show our vaccination certificate. If we remember a time ago when we started the vaccination, this was not in our focus, but with the process of digitalization, this process of digitalization enabled us to do this, to monitor the entire process. From your speech, your speech reminded me about the lot of the vaccines that was a challenge 10 years ago, because these aspects that refer to the quality of vaccines were pointed out as factors that lead to reluctance among parents, because they raise questions about the manufacture of the vaccines. So by by introducing the pharmaceutical wholesalers will enable us to monitor the entire process of immunization from the entry of the vaccines in the country up to the point of administration of the vaccine. So we can perform this monitoring through the barcode, vaccine to patient. So many of the dilemmas that parents faced about how the vaccines are kept and so on could be transparently shared. Today we are talking about hesitancy or mistrust or reluctance to vaccination, but I must point out that at the European Summit organized by the WHO in 2019 in Podgorica, that was supported by the European Commission as well, the mistrust in vaccines was placed as one of the 10 biggest threats to healthcare. Back then, we focused on the new trends in Europe in terms of anti-vax movement and the increased presence and aggressiveness of this type of information. And 10 years later, this was confirmed with the COVID pandemic and the COVID vaccine. After this pandemic, the health systems will learn a lot when it comes to handling health emergencies, but the processes of immunization will not be the same. We have two possibilities to really understand the benefits of immunization. We have pointed out to some historical indicators and facts, but we failed to learn from the past, and the lessons should be repeated more often, it seems. It is part of the psychology of people not to be afraid of what they cannot see. Maybe this is the biggest obstacle when you have to believe in medicine, in science in advance. So it is much easier for us to get a treatment for a disease after developing the disease than to receive something for preventing the disease. So with this, I would like to close this panel with a partnership approach between the state, the Ministry of Health, UNICEF, WHO, and many other experts and stakeholders. Maybe in the most critical period in these past years, we made significant steps in terms of the regular immunization, and let's hope that the numbers that Patricia mentioned will be reduced quickly, and that we're not at the doorstep of another epidemic, of another outbreak, because in a health system like this, where we are still very fragile, we really do not need additional outbreaks of diseases. And the regular immunization also reflects on the other health aspects, which is translated into the impossibility for normal functioning. We have heard the colleagues from the Ministry of Labour and Social Policy. We tried to develop certain policies in order to impose the immunization in order for children to be able to be enrolled in kindergartens and schools only if they're vaccinated. But it showed that if there is a multi-sectoral approach, this could be achieved. I would like to thank all the panelists, and I hope that we managed to point out the important things that we have managed to work on, and it showed also what other activities should be undertaken in the future. Digitalization is part of the future, and what every modern healthcare system needs to invest in. With this, I would like to close this panel, and if you have any questions, you are free to raise them.
Ви благодарам за
Thank you for your presentation. For the panel 1, also panel 2, I'm Professor Ignatova from the Medical Faculty in Skopje. Psychiatry department, my clinical work includes persons using drugs in the Center for Prevention and Treatment of Drug Use. As regards the last discussion, I have a brief comment. As regards the first panelists, I will refer the question later. As regards what was last said, I am a psychiatrist, and I think that motivation of population is challenge for us. This is not a problem of the population. It's not a problem they are not vaccinated. My colleague Katie Stavric also mentioned that interpersonal communication and availability of healthcare workers to people is very important to motivate people. And according to me, as a psychiatrist, motivational interviewing yields much better results than punishment. Motivation to change is a challenge for us also. And we, in interpersonal communication with the citizens, I think even though this seems a harder way, it is much more efficient. I welcome the activity in which UNICEF participates, the Earth Caravan, in environments where they motivate citizens to get vaccinated. This is a comment, but as regards to the first panel and the outreach program, the mobile gynecological clinics, I would like to say that working with people that are drug users and working on gender issues with the OECD office in Italy, we implemented a questionnaire in Macedonia, and we shared with Serbia and Slovenia. Our women who use drugs, Darknet is called the questionnaire. We did not receive any answers where persons did not answer that they didn't need gynecologists in the drug treatment programs. So it is important for these persons to have one-stop shop, to have in one place they treat their drug abuse, and then they receive gynecology services. This was based on the assessment of the research about what women need under the programs. They require specific programs for women that will respond to their needs, so that in the implementation of this program and extension of the program, it is very important these mobile units to visit centers where women drug users are treated. Maybe this should be organized on a special day, on a special, in a special time, and motivate these women. Previously, I work with an international group with children of users. I was surprised to see how many children we have here in Macedonia under the drug treatment programs, and I think that this could be combined with psychoeducational activities about the importance of continual treatment of opiate use and its treatment, because this is care for their children, to avoid any disorders, impulsiveness. And I think it is very good to cover this population in what was mentioned before, and what is very important to me, because I participate in treatment in prisons. It was mentioned, my colleague Tofovsky mentioned the prisons, and that they are planning to examine women. When I made assessment of the conditions in the prisons, we need also gynecologists there. It was very often mentioned by women inmates. They report that ad hoc an NGO would visit them and conduct examination or checkups. Another point I would like to mention is that in the policies for drugs, the gender issues and human rights are top issues, and COVID showed us that when everything stopped, when to travel, drugs continue to travel. This population is vulnerable. They are victims of crime, and the state must take care of this population, particularly of women who are vulnerable category and are double or triple stigmatized. Be a woman and be users. I could conclude that outreach treatment programs are cost-benefit programs. These are not expenditures, but they are investment, because as my colleague mentioned, it is much more expensive to treat a person, surgeries, etc., than implement prevention measures. So I'm open for cooperation with all activities implemented with women drug users, and I dream about improved quality of life for these patients. Thank you very much. Dr. Tovovsky, maybe you would like to respond. We can withdraw and then participate further. I would like first to thank the participants in the second panel discussion. I have a question for them later. But to answer to Dr. Ignatova, the idea to expand this activity to these social vulnerable categories and drug users and partners of drug users also, UNFPA play an important role. We related with HOPS, Options for Healthy Life, and we provided, ensured that part of their clients in a certain day, certain time to be received at their center. The vehicle would arrive there and they could receive all services needed. You offered yourself your assistance, so maybe this discussion we will share our phone numbers with you, with UNFPA colleagues, and organize such activities in the future. As regards prisons, we requested approval from the Directorate for Implementation of Sanctions. There were 68 inmates in Idrizovo, 50 of them applied. The others didn't want to participate. They even have outpatient clinics there with which was used. For 10 years now, they haven't had any integrated activities. This issue could be raised also. For prison in Shutka, we are still waiting for the approval to examine the patients there. So we are open for cooperation. This is a moment to share what we are doing and then join efforts for the future. From the aspect of the second panel discussion, I would like to hear from the aspect of sexual education, because we have cooperation with the Ministry of Education and Science. It is very important, minors, actually it is more important to educate parents in all activities, and also for sexual education and also immunization. This is exceptionally important. How it is planned, maybe there are specific plans to draw these young parents, to influence them in any way. Thank you for your question. We also identified the previous comment about motivation, also your question as regard the communication with the parents. It is essential need. First, I mentioned in my speech, we have new generations of parents. We have generations of parents that social media are their best friends. Information flows or fake news, fake information move very fast at the speed of light, and informal communication of these parents in their groups maybe is a benefit, but also a problem. To share experience, whether positive or negative, not always makes a benefit, because we need to have an individual approach to every child. And about the modules that are developed, there was a module for communication with the municipalities and the parents. Based on the next step, communication on school level, on level of kindergartens, where parents actually in this phase, when they have small children, they are best organized. Inclusion of local self-governments, the municipalities, cities, they should be involved and they have responsibility, because when we stated the coverage information, it was not nice to hear for a municipality to see how bad it is standing. One interesting thing to share is that 5 or 6 years ago we had a problem with rural areas. We had very small coverage with remote areas, areas where good healthcare services are lacking. Unfortunately, now is the other way around. The decline of coverage happens now in urban municipalities in the city of Skopje. This points out the problem indirectly. The problem is in the lack of communication with the new generations of parents that unfortunately, apart from all available information, they tend to choose fake news, fake information. It was pointed out on the page vaccinatia.mk. We have another page where we shared a number of recommendations. The Central Registry of Medications have all registered vaccines with excellent information. We have consolidated reports, information for patients. Everything you want to hear, to learn about the vaccine, you can find. Some of the parents have correct questions. They want to know what type of vaccine it is, what it contains, etc. Unfortunately, these relevant websites are least visited, although they are completely available, open, etc. We, as a committee on immunization, we mentioned that we answered all the questions we received. With field visits, we also wanted to identify the situation in the field. What we saw and what we understood based on the studies is that not that the parents are different, they are new generations, but their attitude towards communication with healthcare workers is different. They come with attitudes, with rigid views, and imposing their decisions on the healthcare worker. Definitely, this is our next step for great efforts, serious work, although I think that the focus should be placed on healthcare workers, because we need to be on the safe side and we need to start with us, with the healthcare workers. So it showed that even we had hesitancy during the COVID-19. It reflected the attitude generally to immunization. We have influenza vaccines for healthcare workers. Every year we had 2 studies, 2 surveys, and the attitude to COVID-19 vaccine was reflected. The influenza vaccine has been around for over a decade. It is not anything new. It is very famous, very well-known disease. The justification for not wanting to take the vaccine, for example, it is new, etc. But there is hesitancy to proved vaccines that have been around for years. So the attitude of our health workers, their personal attitude is not yet favorable yet. They need to be promoters, advocates for immunization services, and this hesitancy is still reflected. This is a key point. We need to work seriously on this issue and agree. Of course, I agree that parents are certainly important part in the communication process. One comment I would like to add, I think that the GPs, the family doctors, could play an important role, and exactly these workshops organized for interpersonal communication, development of such skills and knowledge, A good part of the participants were GPs. I will say again, parents are consulting the family doctors, the GPs, as regards immunization process, and they are the key figures in providing accurate information and establishing communication, information sharing, and they need to undertake measures on time, not when the time comes for the vaccine. To have proactive attitude to communication with parents, GPs are certainly very important point in increasing the vaccine coverage. Once again, if I may, I completely agree with what Dr. Stavric said, and I also think in this direction, motivational interviewing is a skill that GPs need to have, because this is a quick intervention, brief intervention, 1, 3, 5 visits it takes to motivate people. There is no decision without resistance for every man, not for vaccines, for everything. All people tend to hesitate. The challenge for the GPs or for us as healthcare workers is to encourage resistance as regards not taking the vaccine, to the benefit of taking the vaccine. This is a technique, this is a skill that could be acquired by the GPs. I have a specific proposal to deliver trainings of healthcare workers in motivational interviewing for vaccination and everything else, treatment, substance use, treatment, losing weight, diets, anything. This is a technique that could be achieved. The psychiatrist is the one that should train them, obviously. Thank you.
Dear colleagues, ladies and gentlemen, on behalf of the Macedonian Medical Association as its president and in the name of the Association for Cervical Pathology and Colposcopy, to all of you, dear Patrizia Di Giovanni, dear representatives not only on the UNFPA, UNICEF and WHO, but also dear colleague Professor Danova, Professor Tofosky, Professor Stavric and all the others, Professor Grozdanova and all the other attendees, dear representatives of the Ministry of Health and the Ministry of Labor and Social Policy. It is not only a pleasure, but I would also like to express my sincere gratitude, and not only for this cooperation, but for this series of cooperation, especially UNICEF and UNFPA for their long-running cooperation with us. We cooperate not only in terms of reproductive health, immunization, and assisting vulnerable categories of people, as in this project. And I would like to say one sentence. The satisfaction is shared by those who come for a medical checkup. We have received nice words from Adice and Stoyanka from the eastern part of our country, who evaluated this project as really good, and I think that we should continue with this type of projects. Asked by colleagues and by those who do not work in the medical area, why is this? Is this for the first time here in our country? I tell them no. This is also present in developed countries, this type of coverage of vulnerable population or population in remote areas. Other countries can be rich, can have good finances, but this is also implemented in Canada, USA, Austria, Hungary. So our professional associations, we have several presidents of associations of medical professionals in our country, say that this project should become constant in our work. It should be based on the principles on which it is based in other countries, and it should continue working like that, and to the satisfaction and the effects that we have as seen in the feedback from the patients. From my practice, I can say that after the first 3 weeks since the launch of these initiatives, I had identified 3 or 4 initial adenocarcinoma in the cervix of women, and 2 or 3 precancerous conditions. So if we cover this population, we will achieve the desired effect from these screenings and advices and services that we as an innovation process can provide to this population. That's why I would like to thank all of you and to thank all the institutions that were involved in the implementation of this project, especially the Ministry of Health, and hope that this project will continue. We would like to thank the moderator and participants in the second panel, and to all of you who got involved in the discussion. Allow me to keep your attention by sharing with you the main comments for today. The joint program Safe and Innovative Health Services in times of COVID in North Macedonia achieved its objective to improve the access to services for sexual and reproductive health for women and girls, including support to victims of gender-based violence, as well as services for immunization, with special focus on the most vulnerable population in the most remote and underserved areas. The speakers and panelists today shared with us the key results achieved during only 1 year, as well as the lessons learned, but also we will explore the opportunities for upgrading these achievements, for integrating them in the healthcare system, for further improvement and expansion of the access to services for sexual and reproductive health in remote and underserved areas, as well as increasing the COVID-19 immunization rate and the regular immunization rate by continuously upgrading the capacities of the health professionals and by digitalization. The Ministry of Health, in partnership with the UN bodies, will continue to support what was achieved within this program in order for all the activities and services to become sustainable and to be replicated in other regions of the country. The preventive examinations save lives, and COVID-19 must not be a reason for these examinations to be neglected. The suffering and victims of COVID-19 will become ingrained in the universal memory for a long time, but the pandemic also allowed society to see the importance of the health sector and the need for strengthening the mutual relations with the other sectors, especially with the economy and the education. And let's not forget, the pandemic created a link between all the citizens of the world. Solidarity is an essential dimension of future societies. No one should be left behind is not a slogan, it is our collective duty. Dear, we would like to thank your attendance and your attention. And now we invite you to join us for a cocktail lunch in the lobby of the hotel. Thank you.